All right, welcome back. I hope you're having a great week. Today we're continuing our BCBA exam review, where we're going through a full BCBA exam question by question and breaking down each question, how I think you should think about it on the actual exam. So if you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. We are very excited to announce that we have launched our website, bcbastudy.com. There you can find all of our study materials, including the practice exam, the 5th edition task list study guide, our combo pack, which comes with both the practice exam and the study guide. And of course, we have our study session coming up November 28th. So if you're interested in that, follow that link or email me so I can set you up. Other than that, let's get into the questions. Keep working hard, keep studying hard, and here we go. 91. Glenn's client loves to eat Hershey Kisses. Glenn suggests they use chocolate as a reinforcer. The client's parents explain they don't want to use sugar as a reinforcer because they are worried about cavities. How should Glenn proceed? Okay, so pretty common scenario here. BCBAs often use edibles, especially when we're trying to teach a new skill. But of course, edibles have a health risk involved with them, right? Especially if we're using sugary treats, gummy bears, chocolate, that sort of thing. Okay, so in this situation, Glenn knows the client loves Hershey Kisses. They're motivating, but the parent says they don't want any more cavities. What should Glenn do? Okay, in this situation, how should Glenn proceed? A, explain to the parent that chocolate is reinforcing and use chocolate despite their protest. So the first part of A is okay. Explaining to the parent how chocolate is reinforcing, totally acceptable. Using chocolate despite their protest, not so much, right? Parents are involved in the treatment planning process. Parents are within their right to say, I don't want to use sugary treats because of health reasons. That is totally acceptable. We should not go against the parents' wishes in this case. B, request that chocolate be used temporarily. Each time chocolate is delivered, also deliver praise and a token. What is Glenn attempting to do here? Well, he's attempting to create some backup secondary reinforcers, right? Some conditioned reinforcers through pairing. So he's going to deliver the chocolate and then deliver praise and a token. And we're trying to make these conditioned reinforcers, okay? So this is a good strategy, a strategy that should be used anyway. We should always be using praise, okay, and pairing praise with reinforcers regardless, but in this situation especially. Let's fade out the chocolate, but also establish a new reinforcer, okay? So B is very acceptable. On the exam, read all of your answer choices and understand why the wrong ones are wrong, okay? Even if you're sure you know the answer, read all the answer choices. We want the best answer. And when you're studying, okay, it's even more important, right? We want to know why the wrong answers are wrong. That's going to make us better at the test. That's going to help us go faster, okay? So C, terminate services with the client due to the parent's inability to cooperate. The parent is well within their right to not want to use sugar as a reinforcer, so C is incorrect. And then D, use the client's toys as a reinforcer instead of chocolate. Based on the information given, there's no indication that toys are a reinforcer. All we know is that chocolate is a reinforcer. So we cannot assume D, therefore D is incorrect. Our best answer is request that chocolate be used temporarily. Each time chocolate is delivered, also deliver praise and a token. 92, Carol works at a marketing firm. It is her job to pick the newest promotional material for their clients. Carol wants a second opinion, so she asks her friend Dana for help. Carol places 4 different designs on the table and asks Dana which one she likes best. When Dana makes a choice, Carol removes the items Dana didn't choose and puts new items on the table, then asks her to choose again. What best describes Carol's preference assessment strategy? Okay, long question, right? But very straightforward. Very straightforward preference assessment strategy. We have Carol. She's at a marketing firm. Okay, she's got designs for some project, and she needs to know which one Dana likes best. Puts them out on the table, all 4. Dana chooses one. When Dana chooses it, Carol keeps that one and replaces the other 3. Okay, what is this considered? So when we're looking at preference assessments, let's first consider how many stimuli are we assessing. If we're assessing 1, right, we know it's going to be some sort of single choice. If we're assessing 2, it's going to be some sort of paired choice or forced choice. 3 or more, okay, we're looking at some sort of multiple stimulus assessment. In this case, we have 4 different designs, so we know it's a multiple stimulus assessment. Are we replacing items or are we not? Well, Dana Carol removes the items Dana didn't choose and puts new items on the table and asks her to choose again. So Carol is clearly replacing items. So we are looking at multiple stimulus with replacement. Without replacement, we would have 4 designs on the table. Dana chooses an item, then we put the 3 back, chooses again, put the 2 back, chooses again, have 1 left, okay? Not happening. Carol is replacing items. So this is a multiple stimulus with replacement. Okay, 93. Jenny needs to know how often her daycare is taking her son to the bathroom each day. What dimensional quantity would be most useful in identifying this? Okay, so a little tricky, right? Remember, we're looking for the best answer, right? Best answer on the exam, okay? So our dimensional quantities, right, are temporal locus, temporal extent, and repeatability, okay? And within those, okay, we have our quantities of things like duration, frequency, rate, IRT, okay? So in this case, Jenny wants to know what? Well, she wants to know how often her son goes to the bathroom, and then with a time component. So how often her son goes to the bathroom each day. Frequency we know is a count, right? If we add time to it, what do we get? We get rate. So instead of saying her son went to the bathroom 6 times, we now say her son went to the bathroom 6 times per day. So rate is going to be better than frequency. If we look at our answer choices, we have frequency, rate, and repeatability, right? So we know repeatability is a dimensional quantity, and that rate and frequency are the quantities inside of repeatability, okay? So we can't just say repeatability, right? Because it's not specific enough. What's more specific? Well, rate, okay? So the dimensional quantity most useful would be rate. Remember, our 3-dimensional quantities are repeatability, temporal locus, temporal extent, but repeatability is simply frequency, rate, and a count, okay? So the best answer here is going to be rate. 94, burning your hand on a stove, getting wet because you forgot your umbrella, and running out of gas because you neglected filling up your tank are all examples of what? Okay, so be careful here, right? We have 3 scenarios that we are going to assume are bad. Okay, you don't want to burn your hand, you don't want to get wet, and you don't want to run out of gas, right? However, do we know how these are affecting future behavior? Not according to this question, okay? So in order to determine if something is a punisher or a reinforcer, what do we need to know? We need to know what the effect of future behavior, okay, is based on this stimulus, right? So if you forget to run out of gas because you neglected to fill up your tank, how does that affect your future behavior? We don't know. What do we know, okay? Well, we know these aren't antecedents, okay? These are all going to be consequences, right? You burned your hand because you put your hand on the stove, okay? That's the consequence. You got wet because you forgot your umbrella. Getting wet is the consequence of forgetting your umbrella. And running out of gas because you didn't fill up. Running out of gas is the consequence of neglecting to fill up, okay? So we know these are all consequences. We just don't know what type of consequences they are, okay? Because we don't know how they affected future behavior. It's very important, right? On the BCBA exam, they're going to want to know, do you understand that our consequences affect future behavior? And we label consequences based on that impact. Does future behavior increase? Does future behavior decrease? Okay, that's a very important thing to consider when looking at punishment, reinforcement, and other consequences. 95, Juan practices the clarinet every day. He wants to determine what amount of time he spends practicing is most effective at helping him learn a new song. Juan should conduct a what? All right, so Juan has a schedule down, okay? He has an idea of what's going to help him get better at learning a new song, and that is practice, okay? So the component that's going to make him better is practice. What does Juan want to do now? Well, he wants to know how much practice is going to help him, okay? This is a component parametric analysis question, right? What's the difference between a component analysis and a parametric analysis? A component analysis, we're looking at individual pieces, okay, of what makes up an intervention. In other words, if I have an intervention that uses extinction, that uses reinforcement, and that uses a DRA, those are the components, okay? If we're examining each of those components, that's a component analysis. When we want to know how much of something, okay, how much of one of the components is effective, we're looking at a parametric analysis. So if I want to know how much reinforcement is effective, that's parametric, okay? Component is the type of medicine, basically, right? You have Advil, cough syrup, okay, and throat lozenges. Those are our components. If we want to know how much Advil, the dosage, that's parametric. So Juan's component is practicing. He wants to know how much practicing, so he's going to do a parametric analysis. He might practice 30 minutes one day. He might practice an hour one day, okay? He's going to analyze what dosage of practice of the component is going to be most effective. Component versus parametric, very easy once you understand it, okay? So spend a little time really drilling that into your brain, right? And you'll never forget it. 96, Sam is assigned a brand new client. Before the assessment, Sam reviews the client's medical history, school records, and prior ABA records. Sam schedules the assessment for the client's home. She brings an RBT with her to take narrative data while Sam conducts the interview. After the interview, Sam writes a treatment plan and begins intervention. What did Sam neglect to do? So it seems pretty comprehensive, right? But there's something she forgot. So let's look through it. Did Sam review all records at the onset of the case? Yes. Sam reviews the client's medical history, school records, and prior ABA records. Good. So Sam reviewed the records as you should. B, include parents in the creation of the treatment plan. Did Sam have a discussion with the parent with an indirect assessment? Yes, right? Sam brings an RBT while Sam conducts the interview. So she interviewed the parent. The parent is involved in the creation of the treatment plan. Did Sam directly observe all clients before starting intervention? No. Who observed the client? The RBT did, right? The RBT took narrative data. All Sam did was conduct the interview. Sam and all BCBAs cannot write treatment plans using only indirect assessments. You have to have a direct assessment to go along with that indirect assessment. So Sam failed to directly observe all the clients before starting intervention, okay? That is what Sam neglected to do. Again, indirect assessments are good, they're important, but you cannot write a treatment plan, you cannot begin intervention without first directly observing the client yourself. And then D, implement ethical contingencies. We don't know what contingencies she implemented, so D is eliminated. Our answer here is C. Sam neglected to directly observe the client before starting intervention. 97, you might consider using an alternating treatment design if what? So remember, in an alternating treatment design, we are rapidly alternating different treatments, okay, to try to figure out the functional relation between the DV and the IV. When would you use an alternating treatment design, okay? So on graphing questions, if you're not given the graph, try to picture in your head what that graph looks like, okay? Picture the strengths and picture the weaknesses, right? What's good about an alternating treatment design? What isn't so good? Let's look at A. You need to evaluate an intervention across multiple settings. Well, in an alternating treatment design, typically you're only going to be in one setting, but you're going to be rapidly moving between different interventions, right? So it's not really setting based. What kind of intervention or what kind of treatment design would you use for multiple settings? Well, maybe a multiple baseline, right? Because you can go multiple baseline across settings, across individuals, right? So for A, I'd probably use some sort of multiple baseline instead. B, there is a strong possibility that one intervention might impact other interventions. This is probably the opposite reason why you would ever use an alternating treatment design, right? If we have our graph going and we're rapidly alternating between these treatments, if one intervention is going to impact the other one, what's going to happen? Well, that's going to impact our fidelity, right? It's going to impact our functional relation, okay? How will we ever be able to determine if it's our experiment making the difference, or if the interventions are just impacting one another, right? So if one intervention is going to impact another intervention, you might want to avoid an alternating treatment design because they're going to be rapidly following each other, okay? It has a good chance of kind of skewing your data. What about C? Multiple interventions need to be evaluated rapidly. Perfect, right? If we have a lot of interventions and we need to figure out very quickly what will be effective and what won't, we might consider an alternating treatment design because we can rapidly put in, put out, okay, different interventions. So C looks good. Let's read D. You want to withdraw your treatment at some point and then re-implement it. A reversal design or withdrawal design will be much better for D. Therefore, our answer is C. Okay. If there's a possibility that your interventions are going to affect each other, you might want to avoid an alternating treatment design. Okay. So C is our best answer. 98. Laura was able to teach her client to write their name independently after 1 month of working on the skill. Now, Laura will randomly ask the client to write their name once or twice a week. Laura is most likely testing for what? Okay, so Laura taught a skill. After 1 month, the client was able to do it independently. Teaching stopped, and now Laura will randomly ask the client to write their name occasionally. What is Laura trying to test for? Generalization, maintenance, behavior reduction, or response induction? Well, we're obviously not trying to check for behavior reduction, okay? We're trying to check to make sure that behavior's what? Has it generalized? There's no indication of generalization here, okay? Laura's looking to test for maintenance, right? Has that behavior maintained since we stopped working on it, okay? Maintenance is very important with our clientele, okay? Because we want to be sure those skills persist even when training stops. So by Laura randomly asking the client to write their name once a week, twice a week, she is checking for maintenance. She can very quickly identify, okay, this client's lost their skill or they haven't. 98, very easy question, okay? Shouldn't be a problem. 99, your client is generally well behaved whenever you're working on homework with them. However, when mom comes into the room, your client will start talking loudly, standing up out of his seat, and occasionally will throw his pencil. Your client will do this until his mom acknowledges him in some way. Based on this information, this behavior is most likely maintained by what? Okay, again, pretty easy question. I think a common misconception of the BCBA exam is that every question is extremely difficult. That's just not true. Okay, having done this a long time, having taught a lot of BCBAs, most of the questions, I'd say at least 100 of the questions aren't going to be too challenging. Okay, you'll be able to answer them very quickly. At the end of the day, it's still just ABA terminology, right? You can only do so much. So, that being said, through studying, you need to just get better at the test, and these easy questions, okay, you'll be able to do very rapidly, so you can save time and save energy for the harder questions, right? This question, so simple, right? What do we think the behavior is maintained by? Well, generally well-behaved whenever you're working on homework, so probably not escape. However, when mom comes into the room, client starts talking loudly, standing out of a seat, and occasionally throws his pencil. Client will do this until mom acknowledges in some way, okay? Pretty clearly, this is an attention-based behavior, okay? Again, really easy question. Not every question on the exam is going to be the most difficult question ever made. When you get an easy one, don't overthink it, answer it, move on. And then 100, okay? You broke up with your girlfriend over 3 years ago. Every 2 or 3 months, she will call you, but you're putting the calls on extinction. However, every 6 months, you pick up the phone or you text her back. What is more likely to occur as a result? Okay, big no-no, right? If we are putting something on extinction, we do not want to just intermittently reinforce those behaviors. What is going to happen if we do that? Well, extinction is not going to happen. Extinction might happen for a little while, but if you give them intermittent reinforcement, we will never reach extinction, okay? Spontaneous recovery, if we don't get extinction, we can't achieve, if we don't achieve extinction, spontaneous recovery is not going to occur. Spontaneous recovery is the reemergence of an extinct behavior, okay? So A and B are out. D, planned ignoring, okay, is a type of extinction. It looks like you're trying to do some sort of ignoring, but you're not being successful, okay? Because every 6 months you intermittently reinforce this behavior. What is going to happen? Most likely resistance to extinction. Resistance to extinction is the amount of responding when a behavior is on extinction. Resistance to extinction is increased when there is intermittent reinforcement. Okay, so I hope you enjoyed. Again, please check out all of our study materials at bcbastudy.com. We also have our group tutoring session coming up. Be sure to check that out. Please like and subscribe. Any questions, email me, leave a comment below. Other than that, keep working hard, and I will see you soon.